Talk about your wife's condition a little bit. That, I think, had a big role in altering and changing what you do now.
Yeah, my wife's health definitely was a driving force behind going this route with my professional career. My wife, we've been married now almost 16 years, and she's never really had normal health. Just kind of funny things, the things that make you go, hmm. And even as a medical student, I remember thinking, my body doesn't do those things. We had our first two children during those two pregnancies. One of them, she ended up in the cardiac ICU with a strange reaction. Another one, she had strange hiving around her whole body that you could watch evolve before your eyes. Ended up in the ICU for that one. And this strange sort of immunological things going on. One of the things that I didn't do is I didn't ask why. And she was relatively healthy, but we trained in Michigan, and I grew up in Michigan, and we ended up leaving the state to go practice in Louisiana. And one of the reasons was because she couldn't walk very well when it got cold. So that's an interesting concept. My 30-year-old wife doesn't walk well when it's cold, so let's move out of state, right?
Yeah.
Instead of let's find the problem. But anyway, we moved to Louisiana. I started my solo practice. And I think the combination of having her fourth child down there, environmental changes, a lot of stress in the family, and maybe other things that I don't quite understand, really culminated in a dramatic decline in her health to the point where she was having extreme fatigue, joint pain, bladder pain, numerous, quote, bladder infections, which that really wasn't what was going on, but that's sort of what the label was put on it. Doctors actually gave her diagnoses that she didn't have. Like they would do a test looking for something, and they'd say, well, the second test doesn't actually confirm the diagnosis, but we're going to give it to you anyway. So she was on one treatment that it was actually harmful to her in retrospect. At one point, she was taking about 5 prescription drugs, things like Cymbalta and Neurontin and Lyrica. And you know what? Life was terrible. It's the best way I could say it on camera.
Yeah.
So I had what I call my kitchen moment. I came home at about 2 in the morning from a delivery, stood in my kitchen, and sort of surveyed my life. My wife was in bed, where she was a lot of the time. My kids were sleeping, and I thought, well, I guess this is just what happens when you get older. And I was 34. And fortunately, I had enough presence of mind to go, what are you thinking? And when I said why, this other path sort of opened up in my mind. It was kind of a foggy, fuzzy path, but I knew that that was the path that had the potential of leading me down, leading me to some solutions. And so I decided then and there that I was going to find a better way. So my better way at that time was to get out of medicine. That ultimately led me full circle to doing what I do now, which is to help people use logical, rational, physiologic-based methods to get well.
And I don't want to get too personal, but can you touch on how your wife is doing and some of the steps since you had your kitchen moment?
So what did we do to get her well? Well, it really became a quest to get the whole family well. We really had to change the entire way we viewed health. So most people think it's normal to get sick and fat and tired because that's really what everybody else does around them. Then you see that occasional person with really robust health, and what do you say? Oh, it's their genetics, right? Well, it's not, but it is. It's always everything. So we just began to change our diet. I started some fellowship training in anti-aging, if you will. That led me to begin using more sophisticated nutritional therapies on her, but I really wasn't that smart then. But she got better. Within 6 months, we had her off all but one drug. And it was in December of 2009 that I thought, wow, I think I have my wife back. And then in February of 2010, she developed Graves' disease. And Graves' disease is a really, really serious and very troubling thyroid problem where your thyroid is very overactive. And her heartbeat was 140 beats a minute. Her skin changed. Her hair was falling out. it was really, really a troubling, disturbing thing. And that was really around the time when I was changing my career as well. Um, so I realized after I got over being hit in the face by a 2x4, which is what it felt like, I realized, well, I guess there's more going on than I thought. And so I realized that I had to dig deeper. And so now here we are 3 years later, about exactly 3 years later, and she's off all of her meds. We did not have her thyroid destroyed or surgery done. I fundamentally believed that if we pursued the truth, which was that God made our body to work, not to be sick, if we pursued those truths, that this would resolve itself. And she has absolutely perfect thyroid function now. But we've uncovered some other deeper core issues that were probably the driving force behind that years ago.